Navigating women's reproductive health can feel overwhelming, but understanding the basics empowers you to make informed decisions about your body.
So, Chloe, what brings you in today?
I've been having some irregular periods, and I'm a little worried.
Okay, that's a common concern. Let's talk about the menstrual cycle and what can cause irregularities.
The menstrual cycle is governed by hormones, primarily estrogen and progesterone. These hormones fluctuate throughout the month, causing the uterine lining to thicken in preparation for a potential pregnancy.
Voice. When pregnancy doesn't occur, the lining sheds, resulting in menstruation. A typical cycle lasts around 28 days, but it can vary. Irregularities can stem from various factors, including stress, weight changes, hormonal imbalances like PCOS, or thyroid issues.
PCOS? What's that?
Polycystic ovary syndrome. It's a hormonal disorder common among women of reproductive age. It can cause irregular periods, excess androgen levels, and cysts on the ovaries.
PCOS is a complex condition, but early diagnosis and management can significantly improve symptoms and long-term health. Beyond menstruation, reproductive health encompasses contraception, fertility, pregnancy, and screenings for conditions like cervical cancer.
Here's some information about different birth control options. We can discuss which one might be right for you based on your needs and lifestyle.
Thank you. There are so many choices, it's hard to know where to start.
Contraception offers women the power to plan their families and prevent unintended pregnancies. Options range from hormonal methods like pills and IUDs to barrier methods like condoms. For some, the journey to parenthood isn't straightforward. Fertility challenges affect many couples, and seeking professional help is a sign of strength.
I just hope there's something they can do.
We'll figure it out together, whatever it takes.
The good news is that we have several options to explore, from ovulation induction to IVF. We'll run some tests to determine the best course of action for you. Assisted reproductive technologies have transformed the landscape of fertility treatment, offering hope to countless individuals and couples.
It's time for your annual Pap smear. This is a crucial screening test for cervical cancer. I always get a little nervous before these. I understand, but it's a quick and relatively painless procedure that can detect abnormalities early on when they're most treatable.
Regular screenings, including Pap smears and HPV tests, are vital for detecting and preventing cervical cancer. Early detection saves lives. Breast health is another important aspect of women's reproductive well-being. Regular self-exams. Sarah, a typical teenager, faces more than just homework and social drama. Her health is silently suffering under the pressure of academic expectations.
Hey, Sarah, mind if I sit here?
Oh, hey, Mia. Sure, go ahead.
You look exhausted. Everything okay?
Just a lot of studying. Barely sleeping.
Sarah admitted that the pressure to perform well academically was beginning to affect her health. Seeking help, Sarah visits Dr. Lee to discuss her symptoms.
So, Sarah, you've been experiencing headaches, fatigue, and trouble sleeping.
Yes, and my stomach's been a mess. I think it's stress.
Stress can manifest in many ways. It's important to manage it. We can discuss some strategies.
Dr. Lee explained the importance of addressing both physical and mental well-being, highlighting the interconnectedness of mind and body. Sarah attempts mindfulness techniques, but finds it difficult to quiet her racing thoughts.
To herself, focus, just focus. Oh no, I forgot I have a test tomorrow.
The pressure of her academic life was still weighing her down. Mia encourages Sarah to incorporate physical activity into her routine.
Come on, Sarah. Just a quick game. It'll clear your head.
I don't know, Mia. I should really be studying.
Studying can wait. Your health can't. Besides, a little exercise will help you focus later.
Sarah reluctantly agrees, realizing the importance of taking breaks and engaging in physical activity. Sarah and Mia collaborate to create a more balanced study schedule, prioritizing breaks and self-care.
Okay, so we break down the chapters into smaller sections and take 15-minute breaks every hour. Deal?
Deal. And maybe we can actually hang out sometimes, not just study.
Definitely. Movies, hikes, whatever you want. Health first, grades second.
Sarah recognizes the need for social connection and setting realistic goals, understanding that mental well-being is just as crucial as academic success. Sarah begins incorporating healthy eating habits into her daily routine, emphasizing the connection between diet and overall well-being.
Are you sure you know how to make this?
Yes, Mom. See, I'm adding the greens that Dr. Lee advised.
Simple actions, such as home cooking, can lead to greater health benefits. Weeks later, Sarah returns to Dr. Lee for a checkup, showcasing positive changes in her health and well-being.
You look much better, Sarah. How are you feeling?
Much better. The meditation, the exercise, the balanced studying, it all helped.
That's wonderful to hear. Remember, taking care of yourself is not selfish. It's essential.
Dr. Lee emphasizes the importance of self-care and balance, reinforcing the message that prioritizing one's health is crucial for long-term well-being. We join Sarah and her children as they visit Dr. Amara for Lily and Tom's checkup.
Dr. Amara, I've been reading so much online about vaccines, and I'm starting to get worried. Are they really safe for Lily and Tom?
That's a very common concern, Sarah, and I'm glad you brought it up. Let's talk about why vaccinations are so important for your children's health.
Imagine your body is like a fortress. Vaccines are like training exercises for your immune system, teaching it how to recognize and fight off dangerous invaders before they can cause serious harm.
Vaccines work by introducing a weakened or inactive version of a disease into the body. This allows the immune system to create antibodies, which are like tiny soldiers that can recognize and destroy the real disease if it ever tries to attack.
So, it's like giving my body superpowers.
Exactly, Lily. Superpowers to fight off germs and stay healthy.
In the past, diseases like polio, measles, and whooping cough were common and caused devastating illness and even death. But thanks to vaccines, these diseases are now rare in many parts of the world.
But what about the side effects? I've heard that vaccines can cause autism or other problems.
That's a common misconception, Sarah. Numerous scientific studies have shown that there is no link between vaccines and autism. The side effects of vaccines are usually mild and temporary, like a fever or soreness at the injection site.
Dr. Amara addresses Sarah's concerns with evidence-based information. The risks of contracting a disease far outweigh the risks of experiencing a side effect from a vaccine. Vaccines are one of the safest and most effective medical interventions we have.
Think of it this way. Vaccines not only protect you, but they also protect others around you who may be more vulnerable, like babies who are too young to be vaccinated or people with weakened immune systems.
Like protecting my baby cousin.
Exactly, Tom. You'd be a superhero for your whole family.
When a large percentage of the population is vaccinated, it creates herd immunity, which helps to protect everyone, even those who can't be vaccinated.
Thank you, Dr. Amara. I feel much better informed now. I want to do what's best for my children, and it sounds like vaccines are the way to go.
I'm so glad to hear that, Sarah. We're here to support you every step of the way. Let's get Lily and Tom up to date on their vaccinations today.
Thanks to vaccines, Lily and Tom can enjoy a healthy and happy childhood, playing and learning without the fear of preventable diseases.
Vaccinations are a safe and effective way to protect your children from serious diseases. Talk to your pediatrician about the recommended vaccine.
Anna has been experiencing digestive issues and skin rashes. She's visiting Dr. Lee to find out what's wrong.
I've been feeling awful, Dr. Lee. My stomach hurts constantly, and I've got this itchy rash that won't go away.
I understand, Anna. Let's run some tests to see if we can identify any food allergies or intolerances.
Food allergies and intolerances are common, but they're not the same thing. An allergy involves the immune system, while an intolerance does not. The tests are back. Dr. Lee is ready to explain the results to Anna.
Anna, the tests indicate you have a peanut allergy and a lactose intolerance.
A peanut allergy? That sounds serious.
It is, but it's manageable. With a peanut allergy, even a small amount can trigger a reaction. We'll prescribe an epinephrine auto-injector, just in case.
Anaphylaxis is a severe allergic reaction that can be life-threatening. Epinephrine can reverse the symptoms. Now, Anna has to be extra careful about what she eats. Reading labels is crucial.
To herself. May contain traces of peanuts. Nope, this one has milk. Ugh, this is harder than I thought.
Eating out can be tricky. Always inform the restaurant about your allergies and intolerances.
Excuse me, waiter? Can you tell me if this dish contains any peanuts or dairy?
I'll check with the chef, ma'am. One moment.
Cooking at home allows for complete control over ingredients.
Okay, almond milk instead of regular milk, and sunflower seed butter instead of peanut butter. Not quite the same, but it works.
With careful management, Anna is feeling much better.
Anna, you look fantastic. How are you feeling?
So much better, Dr. Lee. My stomach issues are gone, and the rash has cleared up. It's amazing what a difference it makes knowing what to avoid.
I'm so glad to hear that. Remember to always carry your epinephrine auto-injector and be vigilant about reading labels. With proper management, you can live a full and healthy life.
Food allergies and intolerances can be challenging, but with awareness and careful planning, you can still enjoy life to the fullest. Remember, if you suspect you have a food allergy or intolerance, consult with your doctor or a registered dietitian. Early diagnosis and proper management are key to maintaining your health and well-being. Welcome, everyone. Let's begin by sharing any recent challenges or successes in managing our allergies.
I've been getting better at dining out. Last week, I found a new restaurant that's really attentive to allergy requests.
That's great, Anna. It always helps to have supportive places. Exploring fresh local produce opens new possibilities for safe eating.
These look amazing, and they're all safe for me.
Palliative care focuses on providing relief from the symptoms and stress of a serious illness. It aims to improve quality of life for both the patient and their family.
Anna, how are you feeling today?
A little tired, doctor, and the pain is still there.
We're adjusting your medication to manage that, Anna. Sarah, we're focusing on making Anna as comfortable as possible. This is what we call palliative care.
What does that really mean, doctor?
It means we address her physical, emotional, and spiritual needs. It's about improving her quality of life, no matter the stage of her illness.
Palliative care is not just for those nearing the end of life. It can be beneficial at any stage of a serious illness. Palliative care can be provided in various settings, including hospitals, nursing homes, and even at home.
Your blood pressure looks good, Anna. How's your appetite been?
Not great, Mark. Everything tastes like cardboard.
We can talk to your doctor about that. Sometimes a simple change in medication or diet can make a big difference. Palliative care includes managing symptoms like loss of appetite.
It's good to know there are things we can do to help.
Palliative care also addresses the emotional and spiritual needs of patients and their families. This often includes counseling and support groups.
How are you feeling this week, Sarah?
It's hard. Seeing my mum like this, I don't know how to cope sometimes.
That's completely understandable. Remember, it's okay to ask for help. Sharing your feelings with others who understand can make a big difference. Palliative care is also about supporting you.
End-of-life care is a specific type of palliative care for people who are nearing the end of their lives.
Sarah, I know this is a difficult time. We're here to ensure Anna's comfort and dignity in her final days.
What can we expect?
We'll manage her pain and other symptoms. We'll also provide emotional and spiritual support for both of you. End-of-life care focuses on quality of life when a cure is no longer possible.
Thank you for everything.
Hospice care provides a range of services, including medical care, emotional support, and spiritual care. The goal of hospice is to allow patients to live as fully and comfortably as possible. Palliative and end-of-life care are essential for providing comfort, dignity, and support to individuals and their families facing serious illness.
I'm so grateful for the care Mum received. It made such a difference in her final months, and it helped me cope too.
Understanding and accessing these services can greatly improve the lives of those facing life-limiting illnesses.
If you or a loved one is facing a serious illness, talk to your doctor about palliative and end of life.
Anna has been experiencing chronic pain for years, impacting her daily life. She's seeking help from Dr. Lee.
Anna, I understand you've been dealing with chronic pain for a long time. Can you describe what you're feeling? It's a constant ache, sometimes sharp, sometimes dull. It's mostly in my back and legs, and it makes it hard to do anything. Okay, we need to explore a comprehensive pain management strategy. It's not just about medication.
Effective chronic pain management involves a multifaceted approach. This includes physical therapy to improve mobility and strength, mindfulness and meditation to reduce stress and improve coping skills, and dietary changes to reduce inflammation.
Good, Anna. Keep your core engaged. We want to strengthen these muscles to support your back.
It hurts a little.
That's normal at first. We'll adjust as needed. The goal is to gradually increase your strength and flexibility.
Mindfulness meditation can help individuals focus on the present moment and reduce the perception of pain.
Focus on your breath. Notice the sensation of the air entering and leaving your body.
Anna finds that even a few minutes of daily meditation helps her manage her pain.
Certain foods can contribute to inflammation. We want to focus on an anti-inflammatory diet, rich in fruits, vegetables, and omega-3 fatty acids.
So, less processed foods and sugar?
Exactly. And we can explore supplements like turmeric and ginger, which have anti-inflammatory properties.
Anna, how have you been feeling since we last spoke? It's been better. The physical therapy and meditation have helped. The dietary changes are harder, but I'm working on it. That's great to hear. We can also consider medication if needed, but it's often most effective when combined with these other strategies.
Managing chronic pain is a journey. It requires patience, commitment, and a willingness to explore different approaches. But with the right tools and support, it is possible to live a fuller, more active life, even with chronic pain.
Remember, everyone's experience with chronic pain is unique. It's essential to work closely with your healthcare provider to create a personalized pain management plan that addresses your specific needs.
There are many resources available to help you manage chronic pain. Don't hesitate to reach out for support. Welcome, everyone. Chronic pain is something many of us face, and this group is a place to share experiences and offer support. I've been trying some new techniques suggested here, and they've really made a difference.
It's comforting to know I'm not alone in this. The support here has been invaluable.
Remember, each step forward is a victory.
I've been feeling so tired lately, doctor. And I seem to be getting sick more often.
Okay, Anna, let's run some tests, but it might be a good idea to look into supplements and vitamins.
Dr. Amara suggests that Anna's symptoms could be due to a vitamin deficiency. She explains the importance of vitamins and minerals for overall health. Vitamins are organic compounds that our bodies need to function properly. They are found in various foods, and each one plays a unique role.
Excuse me, I'm looking for a multivitamin, but I'm not sure where to start.
Certainly, it's great you're being proactive. A multivitamin can be a good base, but it's also important to consider your specific needs.
The pharmacist explains the different types of vitamins, A, B, C, D, E, and K, and their respective benefits. Vitamin A supports vision and immune function. B vitamins are crucial for energy production. Vitamin C boosts the immune system. Vitamin D is essential for bone health. Vitamin E acts as an antioxidant, and vitamin K aids in blood clotting.
Okay, Anna, your results show that you're deficient in vitamin D and B12.
So what should I do?
I recommend a vitamin D supplement and a B12 supplement. We can also discuss dietary changes to incorporate more of these vitamins naturally.
Anna starts incorporating vitamin D-rich foods like salmon and eggs into her diet, as well as B12 fortified milk. She also starts taking the recommended supplements. After a few weeks, Anna notices a significant improvement in her energy levels and overall well-being.
Your blood test results look much better, Anna. Your vitamin D and B12 levels are now within the normal range.
That's great news. I feel so much better too. Thank you, doctor.
Supplements can be a great way to ensure that you are getting the proper amount of key vitamins and minerals in order to support your health.
And that's how I realized the importance of vitamins and supplements. I feel like a new person.
It is essential to remember that supplements and vitamins aren't substitutes for real nutrition from whole foods. By prioritizing a healthy diet, lifestyle, and appropriate supplementation, you can promote your body's natural functions for long-term health. It's about making informed choices and understanding what your body needs. Is it really necessary to take supplements if I'm eating well? Great question. While a balanced diet is best, certain factors like age, health conditions, and lifestyle may increase your needs for certain nutrients. The seminar discusses the role of supplements as part of a holistic approach to health.
Today was another great day. I felt so energized during my run, and the seminar made me appreciate how far I've come.
We begin in a classroom where a teacher is about to impart some vital knowledge.
Good morning, everyone. Today, we're diving into a topic that's essential for our health: hydration.
Water. It's so simple, yet so vital. But why is it so important?
Our bodies are about 55% to 78% water, depending on our age. It's involved in nearly every bodily function.
Anna explains the crucial role of water in maintaining bodily functions.
It helps regulate our temperature, transports nutrients, and flushes out waste.
From your brain to your toes, water keeps everything running smoothly. Dehydration, on the other hand, can cause a whole host of problems.
David, are you feeling all right? You seem a little sluggish.
I have a bit of a headache, Miss Anna, and I'm really tired.
That might be dehydration. Headaches and fatigue are common symptoms.
Anna identifies possible dehydration in one of her students. Other signs include dizziness, dry mouth, and dark urine.
The good news is it's easy to prevent dehydration. Just drink plenty of water throughout the day.
Anna offers a simple solution to avoid dehydration: regular water intake. But how much water is enough? And are there other ways to stay hydrated?
A common guideline is the 8 by 8 rule, 8 8-ounce glasses of water a day. However, this is just a general recommendation.
Anna explains the popular, but not always accurate, 8-8-8 rule. Your individual needs depend on factors like your activity level, climate, and overall health.
Does that mean athletes need to drink more?
Exactly, Maria. When you exercise, you lose fluids through sweat, so you need to replenish them.
Anna confirms that increased physical activity demands more hydration. During intense physical activity, consider sports drinks with electrolytes to replace those lost through sweat.
And remember, water isn't the only way to stay hydrated. Many fruits and vegetables have high water content.
Anna broadens the discussion to include alternative sources of hydration. Watermelon, cucumbers, oranges, and spinach are all excellent choices.
Be mindful of what you're drinking. While juices and some other beverages contribute to hydration, they can also be high in sugar.
Anna warns against relying solely on sugary drinks for hydration. Water should always be your primary source of hydration.
Staying hydrated is a simple yet powerful way to boost your health and well-being, so drink up and feel the difference.
Anna concludes the lesson, emphasizing the importance of hydration for overall health. Remember, listen to your body and drink when you're thirsty. Make hydration a daily habit for a healthier, happier you.
Oh, not again. This stomach thing is really getting old.
Anna had been experiencing recurring stomach problems for weeks. A busy work schedule made it impossible to see a doctor during regular hours. Desperate for relief, Anna decided to explore telemedicine.
Wow, this looks promising. I can actually talk to a doctor now?
The process was simple. Anna provided her medical history, chose a doctor specializing in gastroenterology, and scheduled a virtual appointment for that evening.
Hi, Anna. I'm Dr. Lee. Thanks for using our telemedicine service. How can I help you today?
Hi, Dr. Lee. I've been having these terrible stomach pains and bloating for weeks. It's really affecting my work.
Anna described her symptoms to Dr. Lee.
Okay, Anna. Based on what you've told me, it sounds like you might have irritable bowel syndrome. But to be sure, I'm going to order a blood test and a stool sample.
Okay, that sounds good.
I'm sending a prescription for an antispasmodic medication to your local pharmacy to help with the pain. We'll discuss the test results next week during a follow-up appointment.
Thank you so much, Dr. Lee. This is a huge relief.
You're welcome, Anna. Feel better.
Dr. Lee scheduled a follow-up appointment and sent the prescriptions to Anna's pharmacy. Anna quickly picked up her medication.
Hi, Anna. Your test results are back, and everything looks normal. It's likely irritable bowel syndrome. Let's discuss lifestyle changes.
Okay, what should I do?
I recommend starting with dietary changes, like avoiding processed foods and reducing caffeine intake. Also, try to incorporate stress-reducing activities into your day.
Dr. Lee walked Anna through managing her IBS through diet and lifestyle modifications. Anna followed Dr. Lee's advice. She started cooking healthy meals, practicing yoga, and making time for relaxing walks.
I feel so much better. I can actually focus on my work now.
Thanks to telemedicine, Anna was able to receive timely and convenient medical care, leading to a significant improvement in her health and quality of life. Telemedicine offers a convenient, accessible, and affordable way to receive quality medical care from the comfort of your own home. If you're struggling to find time for traditional doctor's appointments, consider the benefits of telemedicine. Your health is just a click away.
This really has changed my life for the better. I'm grateful every day.
Anna continued to embrace healthier living, without the frequent stomach pains that once troubled her. Hey, Anna, you seem to be in a great mood lately.
Yeah, I finally figured out my health issues thanks to telemedicine. It's like a weight off my shoulders.
That's great to hear. I might need to give that a try. We begin our exploration of healthcare technology with a look at how it's fundamentally changing patient care and medical practices.
For years, we've relied on traditional methods, but the rise of digital health, AI, and advanced diagnostics is ushering in a new era. An era where we can provide personalized, proactive, and ultimately better care.
From electronic health records to telemedicine, wearable sensors, and artificial intelligence, the spectrum of innovation is vast and rapidly expanding. These advancements are addressing some of the most pressing challenges in healthcare. One of the most exciting frontiers is the development of AI-powered diagnostic tools. Let's hear from some innovators in the field.
Our AI algorithms can analyze medical images with incredible speed and accuracy, helping doctors detect diseases like cancer at earlier stages.
We're also developing AI-driven personalized treatment plans, which take into account a patient's unique genetic makeup and lifestyle factors.
Telemedicine is breaking down geographical barriers and making healthcare more accessible to patients in remote areas or those with mobility issues.
It's so convenient. Dr. Lee, I don't have to travel all the way to the clinic, and you can still keep an eye on my blood pressure from here.
Exactly, Maria. Remote monitoring allows us to intervene early if we detect any warning signs.
3D printing is revolutionizing regenerative medicine, opening up the possibility of creating custom-made implants, prosthetics, and even artificial organs.
We're using biocompatible materials to 3D print scaffolds that can support tissue regeneration. Imagine being able to replace damaged organs with new ones grown from a patient's own cells.
Augmented reality is enhancing the capabilities of healthcare professionals, providing them with real-time information and guidance during complex procedures.
With AR, I can see a patient's scan data overlaid on their body during surgery. It's like having X-ray vision.
It really cuts down on errors too, now that we can verify medication and patient information with a quick scan. Assistive technology, like exoskeletons, is empowering individuals with disabilities to regain their independence and improve their quality of life.
It's like being reborn. This technology has given me back my freedom, my ability to explore the world again.
As healthcare technology continues to advance, it's essential to address ethical considerations and ensure equitable access for all.
We must prioritize patient privacy, data security, and algorithmic transparency. The future of healthcare depends on our ability to harness technology responsibly and ethically.
The possibilities of healthcare technology are